Marcus Garvey Leadership Charter School was basically founded actually 10 years ago. And basically the whole principle behind it was actually to incorporate the school, the community where the school sit, all together, because basically we believe in order to make a difference in our community, we all must have a common goal, and the school is basically one of the common goals in our area.
At the University of Oklahoma, our mission for the Marcus Garvey program is to establish a relationship with the target community, enlighten through engagement and active discussion to ultimately promote self-reflection, empower with resources and knowledge to encourage awareness for the prevention of type 2 diabetes, and finally execute through changes in lifestyle and influencing changes within themselves and those around them.
With this grant, we hope to provide educational supplies for hands-on learning, such as equipment for physical activity education, fruits and vegetables for a healthier diet, and to provide poster boards and writing utensils for discussions and presentations. We also hope to expand the health fair at Marcus Garvey to serve more of the population and to provide services that could not be provided in previous years.
Sometimes I get a good feeling.
RX Express is a mobile service that drives around to local schools, churches, and grocery store parking lots in disadvantaged areas to provide pharmacy services to the underserved. Pharmacists and student pharmacists will provide blood pressure screenings, blood glucose screenings, and go through patients' medications to counsel on specific regimens. We believe that our initiative will positively impact the St. Louis community by increasing health care awareness, improving health literacy, and help patients realize the value of their neighborhood pharmacist.
Think about that new medicine mobile, RX Express.
Oh, that had the nice pharmacist, yeah. That nice young woman, she came to the church the other day. Why can't doctors be more like her? This woman drove up to our church and asked if we took meds. Oh, yeah. Well, of course we do. Most of us can't function without them. I mean, this young woman, she asked me to bring all my meds with me the next time I came to church. Anything I use, from my head to my toes. We were running through the park one day and we saw like our peeps walking the dogs, and like peeps picnicking, the usual.
Then we turned our normal corner like normal, and there was this giant bus, and we're like, oh my god, something RX Express? And these peeps were like crowded all around it.
So like we hopped and like we puffed and all the way over to see what the commotion was.
And like they were doing blood pressure screenings for free.
For free.
Totally. So we were...
Diabetes is hard to watch. Doctors say you need to watch what you eat. Doctors say you need to exercise. Doctors say this. Doctors say that. So much. Right? Doctors say that. But the most important thing doctors say he needs to check his sugar.
Washington, D.C., the nation's capital. Behind visuals of national landmarks like the Washington Monument and the Lincoln Memorial lies some of the most medically underserved areas in the country. According to the District of Columbia Primary Care Association, about 300,000 live in these underserved areas, even though D.C. has one of the highest physician-to-population ratios in the nation. As future professionals, we are charged with addressing this type of issue, especially since the local area around Howard University College of Pharmacy contains some underserved populations. During our journey around D.C., we asked D.C. residents a few health-related questions that may or may not affect their lives to see how much they know.
I guess my notion of diabetes is connected to insulin. That insulin is one of the
diabetes. I don't know much about diabetes.
I'm not sure what the true. It's a thing about. It's a disease about your blood sugar. That I know.
Free patient education is needed in the D.C. area to help patients fully understand diseases and health care that may affect them directly or indirectly. A health fair held on Howard University's campus will be the best venue to reach out to the community. Services such as blood pressure readings, blood glucose checks, free HIV testing, Medicaid information, pharmacist brown bag reviews, and more will be provided. Since pharmacists are the most trusted health.
Hello, we are the students of the SNAFA chapter at Wingate University School of Pharmacy, the Charlotte Men's Shelter. Flu season is a time when the homeless tend to get sick and are either unable to afford a flu shot or unable to get the transportation needed to get a flu shot. Because these men are in close quarters each night, this provides a harsh breeding ground for viruses that can lead to the flu. However, this can be prevented with the simple vaccine. According to the CDC, North Carolina is one of the hardest hit states with influenza-like illnesses for the 2012-2013 flu season. Through this project, our goal is to provide beneficial services to the men's homeless shelter through educational resources, flu prevention packets, and additional services. We hope to provide these men with just a little hope and encouragement, as well as providing them with the 2012-2013 flu vaccine in hopes of preventing the spread of influenza virus within the shelters. We want to thank
International Drive, where SNAFA members at California North State learn and develop ideas. Today, we are lucky to have Christian here help us talk about serving the underserved community. So what does underserved mean?
When somebody doesn't have access to healthcare or good food to eat.
It's when somebody can't get the basic needs because they don't have education or money or have a language barrier.
Can we do something to help the underserved community?
Yeah.
Like treating them with respect?
There sure are many ways we could help. Now let's go to Kim and Dina, who will share with you about our plan to help the underserved community. The underserved community of Sacramento County faces obstacles ranging from the affordability of healthcare services, health insurance for example, to locating physicians and healthcare workers who accept work at reduced rates, as well as a poor diet resulting from the lack of affordable and accessible healthy food.
Our vision to help the underserved population maintain and improve health will be to provide more healthcare information and education, as well as motivation.
Our service project will involve holding a bi-monthly community exercise gathering and mini health fair at the state capitol in Sacramento during the months of February and March.
Hi, I'm Cynthia, one of the project coordinators. In our community gathering, we will be providing patient education on asthma, diabetes, and hypertension. Blood pressure screenings, as well as a 30-minute exercise session with healthy foods will be provided. Please help us to make a difference. Thank you.